Good evening, everybody, and welcome to your October edition of the BSLM webinar series. My name is Zarina. I'm a GP in Nottingham, and I'll be your host for this evening. Welcome to everybody joining us from as far afield as Dubai and Peru, as well as a bit more locally, Norwich and Brighton. Thanks, everyone, for popping in the chat who you are and where you're joining us from this evening. We've got two wonderful speakers lined up for you tonight. Just a little bit of housekeeping, so please make sure that you're on mute and that your video is switched off. Both our speakers are with us live for this evening, so we will be doing a Q&A session at the end. Please use the Q&A tab to pop your questions in there, and we'll put some to our speakers at the end of the two talks. So first up, we have Tim Allardyce, who is a chartered physiotherapist, a registered osteopath and health and lifestyle coach with over 20 years experience. And he has worked at the top end of sport. He has an interest in rehabilitation and digital health, as well as being a strong advocate of the NHS, and is currently working in a long COVID clinic, as well as doing private work. Tim's also presented lectures on behalf of the International Olympic Committee and has been to 6 Olympic Games. He also lectures for the Royal College of GPs and is an NHS clinical entrepreneur. And tonight he's going to be telling us about lifestyle approaches to weight management. So over to you, Tim.
Good evening, everybody. I hope you're doing well. Can everybody hear me okay?
Yes, we can hear you.
Great. I've not got a video, so I'm just going to share my screen and then I will go through the talk tonight. It's really cool to be here talking to you this evening about long COVID rehabilitation. I've been a bit of an expert in rehabilitation for probably 15 or 20 years now, and I've got a really keen interest in all sorts of rehabilitation. A lot of that started with sports rehabilitation, and it's kind of evolved into supporting lots of different aspects of rehabilitation. And one of the things that caught my eye was the issues following COVID and long COVID that we saw, which was so prevalent in the UK. So I felt that it would be worthwhile investigating how we could best help patients in these situations. So let's look at post-COVID-19 condition, or what we more commonly know as long COVID. Well, it's surprisingly prevalent, and I think that I can see most of the people in this talk are general practitioners, so I'm sure that you will have encountered many people complaining of symptoms that resemble long COVID. So it's estimated by the World Health Organization around 10 to 20% of people who get COVID-19 suffer with long COVID, which seems remarkably high. And I'm not sure whether it's as prevalent as the data suggests, but it's certainly very prevalent. Typically arises about 3 months from the onset of COVID-19, and the symptoms last at least 2 months. But actually, we're finding people with symptoms lasting 2 to 3 years. It can be very, very debilitating and cause significant functional deficits. How do we help it? Well, there's quite a few papers out there on rehabilitation for long COVID, and we'll talk a little bit more about that in detail. But just in a nutshell, it's really designed around multidisciplinary teams, person-centered care, and shared decision-making. However, there's no real core assessments for COVID-19. My role involves working as a physiotherapist at a long COVID clinic in Lewisham. So I work with a team at One Health Lewisham, includes a nurse, psychologist, spirometrist, and a doctor. We're very lucky that I'm allowed 40-minute appointments with patients, and that really is a very, very key and significant part of how I can provide significant life-changing help to patients. Everybody's triaged by the long COVID nurse, and there's no limit on the number of appointments. We often give follow-ups monthly, but we're fairly flexible with our appointments. Some patients are discharged on first appointment, and some have a prolonged course of care and treatment. So working in on-COVID clinic has been incredibly interesting. I've seen many observations, and just to run through them fairly quickly, we see a lot of patients diagnosed with asthma by their GP and prescribed asthma medication. However, when we check them with spirometry, there shows no signs of asthma. Most of our patients are obese, and most are diabetics. Most have high blood sugar levels, highly elevated HbA1c. And most patients are low on vitamin D. Most patients, when asking them, have poor sleep patterns, and age really does vary. What do people present with? Well, you'll see all sorts of things coming into primary care and general practice, but probably the most common things that we see of patients with long COVID is fatigue, or what we call post-exertional malaise. Patients coming in complaining of being tired all the time. Lots of joint pains, aching, difficulty taking deep breaths, especially on exertion, a lot of depression, low mood, lack of purpose, anxiety, quite a lot of chest pains and heart palpitations, which is always worrying and difficult to manage and investigate. Coughing, especially persistent coughing, memory loss, brain fog, even change in taste, repeated infections, colds, repeated cases of shingles as well, feeling generally unwell, and gastrointestinal issues, diarrhea, irritable bowel. So it's very, very wide, and it's quite easy to get to blame a lot of things on long COVID as well that can be other issues. So World Health Organization and NICE have given out some rehab guidelines. References are at the back of this slide, but they, in a nutshell, they talk about individualized care, focusing on function and regaining function, especially getting back to work, gently exercising, managing everyday activities, setting goals, pacing, using a gradual approach. They talk a lot about self-management, education, and multidisciplinary team working. Now to the real crux of the talk. I've sped through the first half, so I can concentrate a little bit more on this idea. Is how exactly do we help our patients? And we really can make a massive difference. In fact, GPs can help as well. And we look at all aspects of a person's health. There's no medical, there's no drug, there's no medical intervention that will cure people. It really does have to be looking at every aspect of their health. What I say to patients is that, when you get COVID, it hammers your immune system. It really hits you hard. And this is why we've seen people with comorbidities, people with obesity and diabetes suffering the worst, because their immune systems aren't as strong. Again, low vitamin D is a pattern we keep seeing with patients with long COVID. And, if their immune system is not that strong, then their bodies are not recovering. We see this as well. Very close links with ME, close links with fibromyalgia as well. We're seeing that patients' bodies have got poor immune systems. And what things affect the immune system? Well, the first thing that we look at is sleep patterns. Patients are not sleeping well. That is often because they're obese. They often report things like sleep apnea. Often partners will complain that that the sufferer does not sleep well. They've had to change rooms. The patient themselves will report not sleeping well, but being exhausted during the day. And that's a really big problem, because at night, that's when we heal. That's when our parasympathetic nervous system helps our body to rest and recover. And that's not happening on these patients, so they're not recovering well. Nutrition, we have a particular demographic in Lewisham, which makes things challenging, of course, as you can probably imagine. However, we're seeing patients that have very poor nutritional habits. We're seeing patients that have particularly high carbohydrate diets, especially high with rice, pasta, noodles, fast food. I had a patient come into me about 3 weeks ago, and she lives with her daughter and her daughter's husband and a 2-year-old baby. The 2-year-old gets fed chicken nuggets, and the patient that was suffering from long COVID has takeaways most nights of the week. And, and I just, this requires so much education and support to change behaviors and change patterns. But we see patients with poor nutritional habits, high levels of sugar in the diet, low levels of greens and veggies, high levels of processed foods. And we always ask about what do they drink? I ask a patient and I'll say to them, tell me everything you've drunk today. And they'll tell me they woke up in the morning, they had a coffee, they might have had sugar with that coffee, and then they might have had a fizzy drink at lunchtime. Patients do have bad drinking habits. A lot of our patients drink things like Monsters and Red Bulls. A lot drink Cokes. I had a patient come in that drinks 2 liters of Coke a day, and there's just it's baffling that they haven't worked out that this is a major factor to preventing their immune system from recovering and getting better. What we really need to do is we need to clean up their diet. We need to clean up what they're drinking. And straight away, I put them onto a strict diet of water, sometimes mixed with a little bit of herbal teas can be useful, especially if they're getting inflammation. And reducing coffee, a little bit of coffee is fine. But in most cases, people drink too much. And looking at their nutrition. So we'll talk a little bit more about sort of things that we can do, but nutritional wise, really reducing carbohydrates. So that's a big factor, reducing sugars and carbohydrates. Also reducing meal size. Other things that we tend to encourage patients to do is not eat to their full. So eat to 80% of being full, but don't eat until you feel full. A lot of people, they just keep eating and eating and eating. They eat to their full, then they stop. And so we're trying to reduce meal size. I tell patients to have empty bits on plates where you reduce your carbohydrates, your potatoes, your pastas, your noodles, and your rice. And I try to limit them to pasta and rice once a week. Breathing. So we're finding a lot of patients on assessment have poor breathing mechanics. The next talk will be really interesting because that'll focus on breathing as well by Paul. But breathing is a big issue. Patients are not breathing well. Now that's it. You always ask the question: is it chicken and egg? Were they not breathing well before the COVID, or has the COVID affected their breathing? But we're seeing patients that typically upper rib breathe, so they pull in breath from their upper ribs and their scalenes and their sternocleidomastoid. They're underutilizing their diaphragm. Often they invert breathe, so they actually suck in when they breathe in, rather than let the tummy dome out. And often their breathing rate is too quick, so they're not getting air deep into their lungs. We run through breathing exercises with them, and I'll show you a couple in a minute. Exercise is a big problem. We know the importance of exercise, but it's so hard because patients are suffering such bad post-exertional malaise that they could just walk to the shops and it could wipe them out for 24 hours. So we have to be really careful with exercise and do it really, really, really gradually. If they can only walk 2 minutes before feeling tired, it might be that they only walk 2 minutes and 15 seconds, or maybe they walk to the end of their drive and back, and then they do that twice or 3 times to build up their tolerance really, really slowly, because it's very easy to go and do too much and wipe themselves out for 2 or 3 days. We're seeing enormous numbers of patients with mental health issues, stress management issues, and there are a lot of reasons. It's very complex. All of these patients are complex and chronic, but mental health problems are a big factor, and we know when people are under stress, their immune systems are not functioning well. It's there's so much research to support poor immune health and mental stress, pressure or anxiety on people. So we often chat to patients. We have a psychologist in our team, but we'll chat to patients about what's causing you stress, what's making you anxious at the moment. Is there anything on your mind? Do you have worries? And a lot of people talk about worries at work, or pressure they're under with family, or issues they're under, people have lost loved ones or whatever. And we can talk those through and give strategies and ideas to patients to help manage their stress levels. And medication, there are a lot of people on medication, and sometimes unnecessary medication. So we often look to reduce the medication. I'm a non-medical prescriber, so I've got a little bit of leeway to what I can advise. We often see patients on long-standing things like omeprazole, pregabalin, gabapentin, cocodamol, and these sort of and metformin, of course, and glycosides and insulin. And my experience is when they go onto these medications, it's very, very hard to get them off these medications. And then they're on blood pressure medications and ramiprils and things like that. It's very, very hard. So what we do look to do is to try to reduce their medication where it's appropriate and safe to do so in consultation with their GP. A key part of rehabilitation for patients is education. It's about showing them how to live a healthy life, how to make key changes to break bad habits. Pacing's talked a lot about in the literature, and pacing simply, in a nutshell, just means gradually increasing their physical activity or their work activity to build it up so they don't end up going backwards. So it's about really building up slowly, having plenty of time to rest and recover, and looking at how they're doing and being reflective on their energy levels so they don't overdo it. So breathing exercises, some things we talk to patients about is diaphragmatic deep breathing, and that's really encouraging the diaphragm to use diaphragm as much as possible. So, deep breathing often involves belly breathing. A lot of people suck up through their lungs, through their ribs and lungs and upper chest. But actually, we really want to encourage them to deep breathe, so to use the diaphragm as much as possible and to relax the chest. So a good exercise is to practice 20 deep breaths and try and encourage the tummy to move in and out while not encouraging the chest to lift up, as you can see in the middle photo. Another thing I tend to do is to help them with their mobility. A lot of these patients come in stiff. They have back pain, shoulder pain. They get a lot of joint pains, so we get them mobilizing. Extension-based exercises are great for posture, and having good posture definitely helps breathing mechanics. Improving thoracic mobility and rib mobility helps breathing mechanics. People get stiff because they're sedentary. They're not exercising, they're not getting out. But if we can improve the mobility, get them out, that can really, really help. We also do a little bit of gentle core training with them as well, just to give them some core activation exercises. Once they can, we start to introduce cardiovascular exercises to get them doing some gentle walking or maybe some gentle cycling. Swimming can also be really useful. And a key thing about exercising is really, even if they can't exercise, is to try to get outside, because we're seeing patients with low vitamin D. We know certain demographics and certain demographics have very low vitamin D levels, and patients are not getting outside enough. We're not getting enough sunlight, and our vitamin D levels are low, and that's compromising our immune health. So it's really important to get outside. Just a quick thanks, rehabmypatient.com is our exercise prescriber, so that's where the pictures are, and it's a brilliant software which you can prescribe exercises to, and the 2 references as listed. Please feel free to reach out if you need to. We provide first contact practitioners and link workers to GP surgeries, and if that's of any interest to anybody, especially with link workers, please let me know, because we support patients with community access to local services. So thanks so much, and I'll pass on to Paul in a minute so that so he can do his talk, and then we'll be around for questions at the end.
Brilliant. Thank you so much, Tim. Lots of really useful information in there. Please feel free to pop questions in the Q&A section. I think we've got one question in there that we'll put to Tim at the end of the evening, but feel free to pop more questions in there. So we're going to hear from Paul shortly, but before we do, we're going to see a brief video from BSLM showcasing the recent conference. Thanks so much, Ella. So yeah, the BSLM conference is a conference like no other. For those of you who've been, you'll know how fantastic it is. And if anyone's thinking about going next year, I would really recommend going. You will have a great time. So we're now going to hear from our next speaker, Paul Fox. Paul works with Yoga in Healthcare Alliance charity, and they deliver Yoga for Health, which is a 10-week social prescribing program to patients all over the UK. The charity also delivers a 6-week Yoga for NHS staff program to support stress management and mitigate the risks of burnout amongst healthcare professionals. Paul is going to set out the evidence base for yoga in healthcare and share the impressive results achieved by using yoga as lifestyle medicine for patients via social prescribing. He's also going to share the results of the new Yoga for NHS Staff Wellbeing pilots, following delivery of this to 370 NHS staff. So over to you, Paul.
Welcome to this short presentation about the evidence-based yoga for NHS patients and staff. I'm Paul Fox, the Chief Executive Officer of the Yoga in Healthcare Alliance. Now, some of you will be familiar with the components of a yoga class. These are some of the things you might experience: the physical postures, breathing practices, a relaxation at the end, often everyone's favorite part, maybe some meditation, and there may be some philosophy or spirituality woven through the class, and there may be some lifestyle advice. So how does yoga work? These are some of the categories that we have evidence for, and that is that it promotes autonomic regulation. So that is clearly mainly thinking about people in chronic sympathetic drive, people who are stressed, and we all know how prevalent that is. And it's about addressing that partly by triggering the relaxation response, getting the parasympathetic side of the autonomic nervous system going to balance out what is going on the flight or fight side. So in terms of physiological changes, yoga practice has been shown to raise GABA levels in the brain and endorphins. It's able to lower stress hormones and reduce inflammatory markers. And there's a sense in which yoga has a more global effect. So it promotes homeostasis, and through balancing out body systems helps to strengthen immune function. Heart rate variability is very easily influenced by yoga breathing practices, particularly moving to a breathing rate of 5 to 6 breaths per minute, and particularly using the equal breath, sometimes known as coherent breathing. And what we aim to do in our work as the Yoga in Healthcare Alliance charity is help either patients or NHS staff develop their own personalized yoga toolkit so that they learn a set of practices and then they integrate into their lives as lifestyle medicine, the practices that really work and appeal to them. So yoga also has a potentially significant role in addressing the burden of non-communicable disease, which of course is the biggest worldwide cause of death. And it does that by modifying risk factors. And one of those is chronic stress. As the World Health Organization says, stress is the health epidemic of the 21st century. So just a few bullet points here. It's estimated that 60 to 80% of GP consultations are related in some way to stress. Stress has been normalized and people expect to suffer from it, and yet it still has a very negative impact on body systems, and there's no pill for stress. So one of our roles is to enable family doctors and others to refer patients to our programs, maybe via a health coach or a social prescribing link worker, and therefore address these patient needs that are not really medical in nature, but are more social. So there's a very large body of yoga research evidence now, and it's been growing exponentially. There are over 800 published papers on PubMed, and you'll see on there, if you have a look, that there are now 50 meta-analysis studies, bringing together different studies, and obviously those are gold standard reports on the evidence, positive evidence for the efficacy of yoga. So some of the areas of research that have been covered are listed here. I'm not going to go through them all, but they're quite broad. You can read a summary of the yoga research in the book that I co-wrote. So just flag up a conflict of interest here, that I co-wrote with Heather Mason, who founded the Yoga and Healthcare Alliance charity, and that is Yoga on Prescription. And one of our trustees is the Associate Professor of Medicine at Harvard, Professor Satbir Singh Khalsa, who is also the world's leading yoga researcher and is the lead editor on this book, The Principles and Practice of Yoga in Healthcare, which summarizes the very large body of evidence so that yoga therapists and others can see what is best practice and what works for which conditions. Satbir also has produced this quite helpful, I think, diagram which hints at the global effect on the body and the mind of yoga practice and breaks it down into components that we all really recognize. So there is the fitness, the flexibility, the strength, coordination, balance, the better breathing, respiratory efficiency, and self-efficacy. And those physical factors are not to be dismissed lightly. There's also three other categories, though. There's the self-regulation, emotional regulation, there's resilience, equanimity, and again, self-efficacy comes under that one too. And promoting awareness, heightening mindfulness skills, concentration, cognition, and metacognition. And this is also about reducing mind wandering, which is a big cause of discomfort and unhappiness among patients, and is one of the things that has been measured in several research papers. And then there is spirituality, and although on the programs we teach, we don't overtly teach spirituality, but through the practice of yoga, connection to breath, inward attention and awareness, people do have experiences of feeling very connected, grounded, feeling more connected to themselves, and some of them put a language of spirituality around that. Of course, it's a very important strand in the yoga tradition. All these things feed into improved global human functionality in terms of these domains. So the Yoga and Healthcare Alliance charity offers two programs. One is for patients and one is for staff. And we have a network of about 475 specially trained teachers all over the UK, and we're aiming to get to 1,000 in the next 2 years. So our Yoga for Health is a social prescribing program which was commissioned by West London CCG, evaluated in 2 Westminster University research papers, which I will show you a couple of findings from in a moment. So it's a 10-week social prescribing program. It's prevention and early intervention. And we have referral criteria, which are very broad because it's those at risk of type 2 diabetes or cardiovascular disease, people socially isolated, and people suffering from stress or anxiety, or indeed also mild to moderate depression, which covers a very large number of patients. And coming onto those programs are also a lot of people with long-term conditions and comorbidities, but none of which are in an acute phase. So they're still well enough to attend a general yoga class, which is very gentle because we offer all postures and all practices that can be done in a chair or a wheelchair or on a yoga mat. So it's a really inclusive program. So does Yoga for Health work? Yes, it does. We see here patient activation went up significantly. In fact, all the measures that were taken showed clinically significant and statistically meaningful improvements. So patient stress declined. We have 3 measures here: pre-intervention, post-intervention, and 3-month follow-up. And similarly with perceived social isolation and connectedness, that went up through the social prescribing elements. And it's not like a yoga class that you would imagine. There's quite a lot of talking as a psychoeducation introduction at the beginning. There's a chance for patients to share their experiences of the class for about 20 minutes at the end and to bind the group together. And we found that that has been a really powerful element of what we are doing. So anxiety has also gone down. So the key findings, 62% of patients went up significantly on the patient activation measure. And that's been a very compelling statistic when we talk to commissioners and GPs, knowing that they have many patients who lack the skills and confidence to manage their own health, and therefore our program does address that. And I've already covered some of the things there, but you can just see that we're using well-recognized and reputable scales and measurements for these different areas that we wanted to find out how much impact we're having in. So the last bullet point is quite interesting. So physical health improved significantly for 45% of patients, and waist circumference reduced by an average of 14 centimeters during the program. And that was a really interesting and surprising finding for us, because we didn't actually mention diet or lifestyle. So this was purely from becoming more aware of the body, from doing the physical practice and the breathing practices. They naturally went on to follow healthier behaviors in other areas of their life, including diet. So we also have the program for staff, which is new for 2023. We got accreditation for that from the Royal College of General Practitioners. It counts as 6 hours of CPD. We have 2 courses, a level 1 and a level 2, so 12 hours altogether. So we're getting a lot of people. It's not just for GPs, though, it's for all healthcare staff. And if we just think about the question of why would NHS commissioners and establishments and primary care want us to deliver the Yoga for NHS staff wellbeing program? Well, it's based on Yoga for Health, so it sits on that lovely evidence base that proves that it works, that I've just shown you the slides for. It was commissioned by the NHS, accredited by the NHS. It's inexpensive and scalable. It has a multi-level impact because it's a bio-psychosocial intervention. And it is, as I said, available for all. And the other reason is, as you know, the state of perma-crisis in the NHS for various reasons, waiting lists up, lots and lots of pressure coming from the demographics that we have, the obesity crisis, the lack of health funding increases matching the growing demand for services. And this has a very obvious impact on staff. And we see that in the sickness absent rates for hospital and community service NHS staff, which were as high as nearly 6% last December. They've declined a bit to 4.5%. But still a lot of people. It's half a million full-time equivalent days lost per year, and that's not just from sickness absence. That's the 26% of people off sick who are off for mental health reasons, usually stress, anxiety, and depression or other psychiatric illnesses. So there's a general sense of dissatisfaction, demoralization shown by the wave of strikes. Although I really hope that you, with your interest in lifestyle medicine, found a good balance in the way that you are able to lead your lives. And we know that there's a lot of staff turnover, a lot of people leaving the profession. And we know also that even at the entry level, that 1 in 5 GP trainees have been identified as being at high risk of burnout. So we've just finished running pilot courses of the level 1 6-hour course to 376 NHS staff over 4 courses. And I just wanted to share with you some results before I run out of time. So I'm very proud of this. It's only 61 responses. It is quite hard to get people to fill in evaluation studies. This has been going up because the last pilot course only finished last week. So I'm still getting, and last time I looked, we're up to about 75. So I'm hoping to get that up to closer to 100. Nevertheless, 61 people and 100% would recommend the Yoga for NHS Staff Wellbeing Programme to their colleagues. So that's a stat we're very proud of. And included in that certification for the 6 hours of CPD, it also confers the role of breath ambassador on the person who's completed the course. So we put a lot of emphasis on that, and we're also quite proud of this stat. So around 60% of people feel confident about sharing the breathing practices they've learned, and 34% say maybe. So we give people options there in a breath ambassador role. They might want to actually teach the breathing practices in person, maybe just sitting one-to-one in a staff breakout area, or over lunch if they see a colleague who would benefit from it, or they might want to signpost a colleague to the short videos that we've produced as resources, which if any of you are interested in looking at are there and freely available on the Yoga and Healthcare Alliance YouTube channel. It'll be useful just to hear 2 minutes from 2 staff who completed the staff wellbeing programme.
I found it really enjoyable. It was certainly useful learning a whole set of new skills. I've never done yoga before. I thought, Paul, you were very good at teaching it, and I've certainly found relaxation useful for my own kind of mental health and well-being.
Yeah, I would agree. I think it's been really valuable and beneficial personally and professionally as well. It's been really useful to have enough time to learn some of the breathing techniques. I have done some yoga previously, but not had enough time to really learn the breathing techniques and how to use that during the exercise. So I found that really useful, and certainly carried on some of the breathing techniques and relaxation at home, which we definitely need.
Absolutely,
yeah. From a health and well-being perspective, I couldn't think of anything better, really. So sort of stress management,
absolutely,
and learning not just to do this in this environment, but taking it home to help you leave work at work.
Just having that time to yourself to just focus on your body, breathing. Yeah. Definitely. Whereas, life, work, it's just so pressured sometimes. Having that moment to just focus on breathing, it's just so important.
We also had some really good qualitative feedback. So I'll just give you a moment to have a look at some of these comments. And then one more page. I think the one on the right, although it's quite long, is particularly compelling. Okay, hopefully you've got the idea that we've everybody's recommending it because they've really enjoyed it. And if you want to find out more, you can go on the Yoga and Healthcare Alliance website, and the next Yoga for NHS Staff Wellbeing course is going to be delivered by me on Zoom from the 8th of November, and there in the future on a rolling basis. but we all are also using our network of teachers to deliver it locally. So wherever you are, again, get in contact with me. So thank you. Finishing with a cartoon. What fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? Thanks very much.
Thanks so much, Paul. You can now pop, the speakers can now pop their videos on and unmute. And thanks everyone for your questions and interaction. It's been really great to see. So what we'll do is, I know some questions have been answered as we've been going along, so thank you to our speakers for doing that. My first question was going to be to Tim, just to follow up on the advice that you give dietary wise. So I've combined 3 questions all together because they all sort of fit the theme. So one question is about expanding on the dietary advice that you give, and that might include any websites or resources that you recommend with benefits in long COVID. And then to follow that up, in the current times with financial difficulties, how do you manage or negotiate that conversation about opting for a healthier food that might cost more? Or do you have any tips for ways that people can improve their diet without compromising on cost? So that's for you. Over to you, Tim.
Is it possible to I can't seem to undo my video.
Oh.
It just says you cannot start your video because the host has stopped it. Is it?
Okay. I'll ask Ella if she can.
Yeah,
Ella,
I think it's just a
to...
settings thing. Ah, here we go.
Yeah, there we
Brilliant.
go.
I'm in.
We can see
right.
it.
So just to make sure I'm correct in what you said. So the first question was, what nutritional advice are we giving to our patients?
Yeah.
This is a really wide question. We focus on a lot of things. So the first thing I'm doing is a significant reduction in carbohydrates. Okay, so let's significantly reduce carb levels. A lot of these patients are diabetic. A lot of them have high blood sugar levels. We can see that on the blood tests. So let's significantly reduce the carbohydrates and sugars in the diet. I do that by limiting them to eating pasta and rice only once a week, cutting out potatoes and reducing bread to once per day. Okay. Other things that you can do. Eating smaller meals. Fasting is very, very interesting. And I do have that conversation with some patients. I'm very pro fasting. It's got to be done carefully and safely, especially if they're diabetic and on glycoside and insulin. So we have to be a little bit careful of that, obviously, because of hypos. But I'm very pro fasting, and I, in some cases, encourage patients to do that for a number of reasons, but mostly to reduce calorie intake, blood sugar level elevation, etc. So what else can we do? Eat less, have smaller meals, don't eat till you're full, don't eat because you're bored, keep yourself occupied, and improve self-discipline. And these patients need encouragement. So we see them regularly, we weigh them every month, and we motivate them, because it's hard to maintain a strict diet. And in fact, it doesn't have to be strict. I tell patients, you don't have to be a saint, but you just have to do good things 80% of the time. And of course, look, I have a pizza on a Thursday night. That's my little treat. And if that's what you want to do, fine. But 80% of the time, I do good things. Now, how do you get over the issue of, yes, it costs more? It does cost more. Of course, eating healthy does cost more. You know, I have a largely organic diet. We have box deliveries from Abel and Cole every week, and I buy as much organic food as I can. Yes, it's more expensive, but I think you can have smaller meals with organic food, and so you tend to want to eat less. I'll give you a good example. I had a Chinese takeaway on Saturday night. It was lovely. I don't do it often, but the next morning I woke up and felt really hungry. Yet I had a massive Chinese takeaway, duck and lemon chicken and sweet and sour chicken. You know, why did I feel so hungry afterwards? And it's because we're gorging on just food that has such low nutritional value. When you eat good quality food, you can actually eat much smaller meals. And so it doesn't have to cost you a massive amount. So I also think you can make cost savings by not drinking coffees all the time from Costa Coffees and Starbucks. Drink water, ideally spring water. So there's loads of things you can do to save costs. It doesn't have to be too expensive, but yes, good quality food does tend to cost more.
Thank you, Tim.
Was that it? Was that the two questions?
That's it. There was one about any good resources or websites that maybe you direct.
Lots. There's long COVID support. So long COVID, longcovid.org is a long COVID support charity for people. The app Visible is good for ME and for long COVID. So Visible helps people track. Longcovid.org. Thank you. Longcovid.physio is long COVID physio rehabilitation and holistic health is very good. Nuffield have a long COVID program, so Nuffield Health as well. So there's a lot of resources out there and support, but Nuffield is good as well.
Great, thanks so much, Tim. Right, over to you, Paul. I think there were a lot of questions about the logistics, about how do you refer either patients or NHS workers or healthcare professionals. What's the format of the yoga? Is it virtual or is it face-to-face? Is it free or is there a cost? But I think someone's answered that in the chat and said that it's affordable. But would you like to just explain about the kind of the logistics? How would someone refer somebody, and what does the yoga program
pathways?
Like?
I mean, that for the patient program, it's social prescribing. We're mainly partnering up with primary care, so we're working with GP practices, health coaches, social prescribing link workers. I run a course, 10 weeks, and then the following term, so every September, January after Easter, I'll run a 10-week course, and I'm very plugged into all the people in my area. So that's what our teachers do. The patients who come on, the service users, what we tend to do is, unless we've got grant funding, and increasingly our teachers do, so the NHS don't pay for this, of course, it's money comes from elsewhere, lottery and other funds. When there is a self-funding model, the service users, maybe 10 who can afford to, will pay, and then 5 to 7 places will be free or very low cost, which can be allocated by the social prescribing link workers to address social determinants of health and health inequalities. For the staff, it's open to everyone, so we're kind of marketing that to large establishments. St George's Hospital in London wins the prize. They sent us 130 staff out of that 370, so they really monopolised the pilots. They probably saw they were free and spotted a bargain. So, but any staff can do that by either enrolling individually or nagging their commissioners to get a program running in their area.
Okay, fantastic. And I will put Rob's little question in here about any evidence that yoga practice in the presence of animals or heat. I think he's referring to goat yoga that enhances the experience or the benefits.
Whenever I do a training, we give a special certificate to any cats or dogs that appear on laps during the training. So we're animal friendly, but not animal focused.
No, okay, fantastic. Thanks very much. Okay, so I think there were a few other questions for Tim. So there was one about seeing patients in long COVID clinic, and obviously the crossover with many other comorbidities like fibromyalgia and ME, and whether long COVID is being seen as the same as that, or is it being seen as a diagnosis in its own right?
It's been seen as a diagnosis in its own right. However, there's enormous similarities with ME. And I think, the key thing is someone actually also mentioned about now there's long cold. Look, what we're dealing with, in my opinion, is the immune system has been hammered, basically. And patients' immune systems are weak. A lot of them have been on steroid use. So, a lot of them have comorbidities. A lot of them have very poorly affected immune systems, which is why they get pretty ill anyway. And so, if we can build that immune health, patients will go to the GP and say, can you prescribe me antibiotics, because I can't get over this chest infection. And it's what we need to do is we need to try to encourage those patients to improve their sleep, improve their diet, reduce their stress, get outside, improve their vitamin D, get some sunlight. These sort of things make a huge difference, and that's very slowly you can start to improve the immune systems.
Fantastic. Thanks so much, Tim. I think we've got time to squeeze one more in with Paul. There's a little bit about, could you learn yoga yourself and then deliver that with your own staff in the practice? Would you, I imagine you'd have to become a yoga practitioner.
Yeah.
And if you do you require any additional indemnity? I think if someone's put it, if you're offering yoga to patients, is there any extra indemnity required?
Yeah, Yoga for NHS is a staff wellbeing program, so we train staff to share breathing practices with colleagues, and then there's in the level 2 further 6 weeks they can share a broader range of practices, including some posture work. And if they complete level 1 and level 2, they can do some more training with us if they want to, and we sort of nudge them down the route towards becoming a qualified yoga teacher.
Yeah.
And I just want to say what we do, and I think the essence of yoga is the breath work, and that is where the real juice and benefits of the practice are. And everything Tim said about the breath, we would concur with. Abdominal breathing, low breathing, really, really important, and slow breathing.
Absolutely. It's something that's so simple, but it can have so many benefits to the body, and so many chemicals change when we take a deep breath in and a deep breath out. So that brings us towards the end of our evening. So thank you very much to both Paul and Tim for joining us this evening and for delivering our talks. Thank you to our audience for generating such interesting questions, and enjoy the rest of your evening. I think we should all take a deep breath in and a deep breath out, and have a good rest of your Tuesday evening, everyone.